Yes, I've really appreciated that clinic. And so what I love is functional medicine. Why do we have functional medicine at Amen clinics? Functional medicine physicians look for the root cause of things. And I love that. So I actually met you for the first time at A4M. We were taking a course, American Academy of Anti-Aging Medicine. And that was before you worked for us. And then you came to work for us shortly after that. And
Daniel shared a plane ride. We shared a plane ride on the way back and talked about it, right?
Exactly. Right. So I really appreciate you coming on. And one of the topics that's always really important with my audience is hormones. So you treat a number of things. I mean, I know you're really good with thyroid. You're really good with Lyme disease, which there's not a ton of people who are great with Lyme disease that are really specialists in it. But you're really good with hormones. And so my crew likes hormones, my age group, and I've been to see you a number of times. It's like, are you sure I'm not in menopause yet? Because I feel like I'm in menopause.
Definitely can be widespread issues with that, no doubt.
Right. So it's real. And what's interesting is you actually can test and find out, you know, whether or not you're in menopause. So I really like that. But I want to talk to you about some of the basics. We can have you back if you, we would love to have you back actually, and talk about some of the detailed things with menopause, more specific issues. But if we could today, I want to talk about some of the basics with hormones, female hormones specifically, maybe a little bit with male hormones if we have time, but also, and we know that female hormones affect males. They affect men, right?
Yes, everyone else around, correct.
Right. They affect relationships. So, but I also want to talk a little bit about, because I've got a new book coming out January 5th called Relentless Courage, The Relentless Courage of a Scared Child. And it's really about overcoming, you know, sort of the early years of trauma. And so trauma, anxiety, grief, and so I want to talk to you a little bit about what growing up in those types of environments might do to set people up. Like, does it affect hormones? And if it does, how? So let's sort of jump in, if it's okay.
Sure. Well, you know, hormones is a very broad topic. You know, typically when you say hormone therapy, everyone, especially women, jump to estrogen, right? That is a very important one, but we have, you know, many others that are more important for different things. So particularly with the stress, the PTSD you mentioned, what can really be affected by that, many hormones, many systems, but cortisol for sure, right? Cortisol is our stress hormone. So when you're stressed, your cortisol goes up. It's supposed to. A little bit of stress is good. A lot of stress, not so much, especially after prolonged periods. What can happen is it's like you can think of it as like your adrenaline level. And so if that's always on full speed, you're in a traumatic household. You know, you're dealing with stress every day, and who knows what kind of, you know, trauma, abuse, what have you. That will just set up your adrenals for failure later on down the road. You can get chronic fatigue syndrome from that, among others. So you can also, cortisol isn't great for your immune system. So when it's high for prolonged periods, your immune system gets suppressed. And then other things can creep in, you know, Epstein-Barr virus, and you get chronic fatigue. So lots of things are interlinked. So again, hormones, we all have the same hormones, men and women. You know, when I say testosterone for women, isn't that a male hormone? Well, of course not. We all have the same. They would just have dramatically different levels of them. So men have estrogen too. We have progesterone too, not nearly as much as women. So those all can be affected in both sexes and for various reasons. So super powerful tool for me, seeing patients really at any age, but especially adults and postmenopausal women. But as we get older, you know, unfortunately, things just don't work as well. You know, that's father time. So after your 20s, you know, it's kind of a downhill slide. Nothing works better physically as you get older. You're smarter, you're wiser, but, you know, we got to really battle against father time and that clock. And one of the most powerful tools for that is hormone replacement therapy. So I do it for preventive reasons, but also for symptoms. So men included, you're right. So if you're 40-year-old male and you're, you know, not so enthusiastic about things anymore, life's not so great anymore, motivation's down, libido's down, belly's getting a little bigger, right? You're in male menopause. That's menopause. And so it's both sides of the street, certainly. Again, we all have the same hormones. So again, the impact is broad, the coverage is broad. So if you had any specific things you wanted to look at, we can go there.
Well, so you brought up something really interesting. You do hormone replacement therapy, which I know because I know you, but I know that this is going to come up. It's going to be a question I'm going to get a lot after this or during this interview. So I recently went to the doctor. I went to my regular OBGYN, Western medicine physician, and I think she's more savvy than most. She actually prescribed me progesterone, for perimenopause, and she wasn't against it. But first thing she said, and she looked at me and she's like, I have to tell you this, I'm required to. You're at greater risk for breast cancer if you take any kind of estrogen or progesterone post-menopause or post-hysterectomy. And I'm like, but what about natural hormones? She's like, it doesn't matter. She goes, here's the problem. We don't have the studies on it. Now, I've heard that for so long, and I've also attended the seminars. And so my understanding is that natural hormones are different, but I want to hear you tell us why. What is the scoop on natural hormones versus synthetic hormones? And does it matter? Can we take them post-menopause or not?
Yeah, and this question comes up all the time, of course, because hormones are associated with cancer, certainly
Right.
in the media. But in reality, there's zero connection with any natural hormone and cancer, causing cancer. Just none, no studies. There are multiple studies showing synthetic hormones, especially synthetic progesterone, called progestins, linked to breast cancer, cardiovascular disease, weight gain, diabetes, on and on and on. So you just don't want those. There's no reason at all to ever use that when you have natural hormones. So what does natural mean? It doesn't mean you go to Whole Foods and get it, and it's made from, soy sprouts. We're talking about biologically identical, meaning the same stuff your body is making now. Doesn't matter where it comes from, really. We're talking about an identical molecule. So, and many doctors, including traditional doctors, are on one hand dissing biological hormone therapy, and they're prescribing it.
Yes.
So if you get a Vivel patch or estrogel, that is bioidentical estradiol. Same thing with progesterone. You can get bioidentical progesterone at Walgreens or Costco pharmacy, right? You can get those. They are bioidentical. It's just the same molecule. This whole thing comes down to being able to patent something.
Okay.
It's pharma and money. You cannot patent
money. Right. It's about money.
So it's a money thing. So the natural have been around forever. Most doctors have used them and maybe not even known it. So the big thing is it's a biologically identical molecule. It's not an alien molecule. So
Right.
It's synthesized. So Premarin is what's been used for so many years for women, which is pregnant mare urine, right? That's
Right.
horse urine extract, not a bioidentical hormone, combined with synthetic progesterone, which is really bad news. So again, no connections with natural hormone use and cancer. Now, I went to an international hormone conference years ago, and even back then, even us in the functional medicine and hormone world, we kind of shied off of using hormones with patients that have had a hormone-sensitive cancer, breast cancer, prostate. But one of the top researchers in the world presented a slide, lots of slides were going by, and one of them said that women who have had breast cancer should be on estrogen therapy to prevent recurrence and death rate. And it was substantial. It was like an 80% reduction in recurrence of breast cancer. So I was like, whoa, what did you just say? Hold the presses, stop the presses. So I actually looked this up, researched it. I have a stack of studies this big showing that exact thing. Multiple studies showing that women that have had breast cancer successfully treated can do better on estrogen. Again, totally counterintuitive, even for us functional docs. So what that did, at least, I don't promote that. It's still iffy in a lot of fields. Patients may be uncomfortable. Fine. What it did for me was just dramatically lower, if not eliminate, my concern for ever using hormones and with cancer in the diagnosis. And this was with hormone-sensitive cancers even. So yes, estrogen receptor positive, progesterone positive, didn't seem to matter. with bioidentical hormone use. Again, that's a controversial thing, but if you look at the data, that's actually what it says.
Yeah, interesting. So I've often said that the reason I'm not on the 6 o'clock news is because of progesterone. It just, for some reason, I'm on a very low dose. It's the edge off.
Yeah.
So it's for some reason, I just, you know that, because you see me, I'm like, what's going on? Are you getting an echo? Do you hear an echo?
A little bit on your side. Yeah.
That's interesting. Are you odd?
Maybe I can turn the volume down here a little bit or something.
Okay, so let's see if we can do this again. So,
yeah, progesterone is, I call that nature's Valium, and I use that a lot. I use it in men and women. So progesterone is technically a neuroactive steroid, which means it's working in your brain like a neurotransmitter.
Yeah.
And it works just like Valium. It calms things down. So if you have anxiety, sleep issues, irritability, it's great for that. And again, your body makes it. Your body's used to it. Zero connection to cancer use with starting bioidentical therapy. So it's great for sleep and anxiety. And I tell a lot of my psychiatry pals here at the Amen Clinic, you could probably get rid of a multitude of drugs that are being used if you just use the hormones.
Yeah.
In a proper situation.
I find it so interesting. One question we have, and I don't know if this is one we can tackle in this short of a time, but a woman asked about PMDD. One of our viewers right now is asking about PMDD. And I know that's an issue we see a lot in clinics. Is there anything you can do about it?
Yeah, so PMDD is, kind of like nuclear PMS, you could think of it.
Right,
and I ask this almost of every female patient that's premenopausal, is whatever you're here for, does any of that get worse before your cycle?
Right.
So people think of PMS as, irritable, but it could be anything. Your depression's worse, your anxiety's worse, whatever you're here for, sometimes it's just dramatically worse at that time. And that's a hormonal issue. So you can take progesterone at that time, second half of the cycle, sometimes either totally eliminate PMS or even PMDD or dramatically reduce it. And progesterone works really well for that. There are other natural supplements that help you modify your hormones, so to speak, detox them properly. So you can really help that a lot without resorting to drugs. And I had one that usually works. I had one patient who had severe PMDD. Progesterone just wouldn't work with her. We tried heavy doses, oral, creams, didn't work. Turned out she had Lyme disease. That was just flipping her out. And that Lyme is the great imitator, right? Because it can make whatever you have worse, even if it's not the current main symptom. So yeah, PMDD definitely can be helped with hormone optimization quite often.
Yeah, that's really interesting. And I like that you said that. It's we see so many women come in suffering, and I love that you said something about supplements. There are just some women who, for whatever reason, they're not comfortable taking hormones, bioidentical or not.
Correct.
What kind of supplements would you say are your favorites for, let's say, perimenopausal or menopausal women with symptoms?
Yeah, so there are some products that are like black cohosh. There are other combinations. There's one actually my wife uses. She gets it from Costco. I can't remember the name of it now, actually, unfortunately. But it's a herbal combo that can work really well for PMS, for night hot flashes, night sweats. You don't have to use hormones. Those can work. DIM, which is cruciferous vegetable extract, helps you kind of detox hormones properly. That can lessen the symptoms. Something called calcium glucarate does similar detox of estrogens and progesterone, so you have less of these hormone effects.
And what about magnesium just for helping you to relax? Does it help at all?
One of my favorite supplements of all time, magnesium. I prefer the powder form, like magnesium citrate. You mix in a little hot water. It's just 100% absorbed. You can vary the dose. It's not one pill or two. It's anywhere in between. Take it at bedtime. Very calming. especially if you have problem with constipation or not regular bowels. It can also help modulate that. So one of my favorite supplements.
Yeah, me too. I bathe in it, basically. I take it every night. It just like takes the edge off. It's great. That's my cocktail. So between my progesterone, my magnesium, and my melatonin, just takes the edge off. It's so great.
Great combo.
Great combo. So let's see, what other questions do we have here? We talked about why natural are different. Someone asked if they can start hormones after menopause.
Can you start them after menopause?
Yeah, if you haven't been on them, can you start them after menopause?
Yes, at any point in time too. So traditionally, doctors will tell you you want to start your hormones within a few years after menopause. If you don't, it's a waste of time. Not true at all. I'll start 80-year-old women on hormones.
Really?
Why would I do that? To make them feel better, right? That's what they're for.
Interesting.
We're not worried about prevention of too much stuff at that age, but can it help you feel better? Can it help you sleep better, think better, more energy? Absolutely. So you can really initiate hormone therapy at any point in time, depending on your goal.
That's good to know. I actually did not realize that. What about with birth control pills?
So birth control pills, it depends what they're being used for. So in many women, they're using it because they have really severe PMS or very severe cramping or severe bleeding, right? So it's controlling their cycles somehow versus just for contraception. But you can still hormone over birth control. Oh. So it won't eliminate the contraceptive effect. You can still use progesterone and birth control pills if you want to. So again, depending on the use.
The effectiveness at all?
No, won't alter effectiveness. That's right.
Interesting. Okay.
And, a lot of women have these IUDs now as well, like Mirena. So there's Mirena, which does have some drugs in it. So there's some hormones in there. Not a lot, nothing like oral doses. And there's also copper IUDs, which are drug-free, for contraception.
Okay. So one thing I want to talk to you about is if a woman has had significant trauma, whether it's, let's say, sexual trauma or abuse or something like that in her early years, whether it's childhood or early development, teenage years, can that affect how her hormones function? Will that alter her long term? Or can hormone therapy actually help sort of alleviate some of the symptoms of that effect that women get, that sort of like, PTSD type of feeling?
So yes, a couple things there. One is, depends on the nature of the abuse. If there's actually physical abuse, especially head injury, you can have actual hormone disruption from head injuries. TBIs can cause long-term hormone disruption, growth hormone, testosterone, other hormones. It upsets your pituitary axis where your hormones are all generated. So that can play a role. On the emotional part, again, I use hormones, particularly progesterone, but others as well, as a medication. Mm-hmm. So I would use progesterone like Valium without upsetting the cycle. Or so if, depending on the nature of what you're trying to treat, you can use hormones almost as a medication.
Oh, that's amazing. Helpful. Well, and one thing that's so important, relationships are so delicate, right? So if a woman's hormones are off, or if a man's hormones are off, but if your hormones are off, it can really affect your intimacy, how you communicate with your spouse, how
Absolutely.
You communicate with kids.
Yes.
And so I think that's really important. For me, I just feel like, why would I want to have my family suffer because I keep thinking that I'm menopausal. I keep coming to you and going, I know I'm menopausal. And you're like, no, you're still perimenopausal. But perimenopausal symptoms are not fun.
No, and that's what you can use hormones at that point as well. So there's a blood test called FSH, which tells you if you're getting close to menopause. It's a follicle stimulating hormone. It starts to creep up and up and up as you get closer to menopause. So some women will come in and say, I don't know, am I near? Am I circling? I don't know. That can help determine it. Generally speaking, you usually end up following in your mother's footsteps when it comes to how bad it is when you go through menopause and when. It's very close, typically. So
Yeah,
some women blame it.
Yeah, with someone wrote in and said she's 59 and still not in menopause, and that's probably the later end, right?
That's certainly at the later end. Yes.
Yeah. So we've got all kinds of good questions on here. We're probably not going to get to all of them. Someone asked, does eating non-processed food help? Of course, we know that one, right?
Yes. Everything.
Helps everything. Tell me if I'm wrong, but when you eat certain processed foods or sugars, doesn't it turn you end up with the bad form of estrogen, correct? To simplify it.
Yeah, your diet can affect the way you metabolize estrogen in a good way or a bad way. Like in cruciferous vegetables, that DIM extract will help you detoxify estrogen in a less cancerous way, really. Right. Your own estrogen. So it helps you metabolize. So that's where diet certainly plays a role.
Okay. And someone else asked about supplements. I'm just going to say we talked about supplements. And so we're going to repost this as a video. You can go back and hear him talking about black cohosh and DIM and all these things that are natural and they're not going to hurt you. If you really don't want to be on hormone therapy, then there are other options. And then someone else said, let's see, she's had a TBI and abuse. Hormones are a mess. No idea what kind of mess specifically. So this is interesting. I know my mom had a really bad brain injury and she was just not recovering and not feeling well. And when we tested her hormones, literally she was wiped out of pretty much everything. So, I mean, she had a bad head injury, like she had a bleed and we almost lost her. So it was, once we put her on hormone therapy, I mean, we had to give her a lot of hormone, like a bunch of different types of hormones. But she feels great. But she's not producing them.
Yeah, it's hugely helpful. In fact, there's one of these back here shows that I'm part of the Millennium TBI Network. So that is a network that treats people with TBI, a lot of vets, but anybody that has a severe head injury. And the entire program is based on optimizing hormones.
Yeah, you can wipe them out, right, with a TBI.
Yeah, you can wipe them out, and they don't come back for about half the people, or 30% to 50%. They just don't ever come back, and end up on multiple drugs, antidepressants, anti-anxiolytics, etc. And it's because their hormones are off. So, that can be extremely helpful, if not curative, for a lot of folks.
Okay. So that's what this person asked. Did you want to know how to find out? And I would suggest you see a functional medicine physician. I know Dr. Filidei is really great, but you need to get tested. I mean, I know my mom had to be tested before we knew what was wrong with her. So we looked at her brain, we tested her hormones, we figured out what was wrong. And so that was just really helpful to see the pictures, to see, when you come to our clinics, we look at your brain and that's a big deal, but that's not all we do. We test your blood. We test, you for so many things. And I know we've had patients go to you, Dr. Filidei, and they're like, what are all these tests? But we end up
never had them. Right?
So interesting.
Well, as Daniel always says, you got to know your numbers, right? That's like
if you don't
your brain, and you got to know your numbers. So how do you do it? You test it. Now, the vast majority of people probably listening to this have never had their hormones checked because doctors won't check them.
No,
they'll check your thyroid probably, but even then, not enough. So thyroid, we get an entire discussion on thyroid because it's hugely important and dramatically underdiagnosed and poorly treated. So there's multiple tests for thyroid. Many doctors just check one, which is nowhere near accurate enough. No. So, there's thyroid issues, which are, quote, more medical hormones, but that's another hormone therapy. People don't think of it so much, but it is.
Well, and when because I've been down the road to thyroid hell, as you know. So I've had thyroid cancer 4 times. I've had multiple surgeries, radiation treatments, experimental treatments. Crazy. And like you said, they weren't checking the right numbers. I was shocked. These are experts. But when I finally found the right doctor, I felt like someone took a straitjacket off of me. It was amazing. And so my energy just skyrocketed. And so that's one thing I know when I talk to women who are like, I've had everything tested. I may have had my hormones tested and I just feel terrible. And I'm like, did you go to someone? Have you been to someone who really knows thyroid? Because if your thyroid's off, you will feel miserable. I know firsthand, you will feel miserable. And
this is rampant in medicine, unfortunately. In fact, there's a whole group of people who just got so fed up with this. They started a whole website. There's a book on it. It's called StopTheThyroidMadness.com.
It's crazy.
And it's all patients that just could not find doctors knew what they're talking about.
No.
And the information on that website is very good.
And it makes you feel a little like you're crazy or like it's your fault.
Yeah, right.
And it's really irritating.
Yeah.
So yeah, that's why once I found an endocrinologist who listened to me. He's this researcher. He calls himself the idiot savant of thyroid because he's he's kind of like this old guy that's up at UCSF. He's this researcher, and he's like, they call me crazy, but I mean, I felt better within such a short time. And he sort of felt like one of us, like a functional medicine person who treats things differently. So big difference.
You have to think outside the box because the box don't work.
No.
Yeah.
No. It's the same old stuff. If you keep doing the same things, you're going to keep getting the same results, right?
Correct.
So let's see. We've got probably one or two more time for one or two. This person said she makes her doctor test for hormones. Great. They're not your daddy. They're not your mommy. And they're not your boss. So make them test. Her daughter does not have thyroid, but is on birth control and levothyroxine. She continues to get yeast infections and stays on diflucan, but she should not be on this forever. Can't find an OBGYN. I don't know. What are your thoughts on that? Are those connected?
The vaginal yeast infections and the thyroid?
Yeah.
Probably not.
Yeah.
Something else going on though, obviously with the candida.
Your gut? Yeah.
The gut could definitely play a big role. And candida is one of the things I always look out for many of our Amen patients because yeast can affect your brain directly. Yeah. It can cause anxiety, sleep problems.
Make you tired.
Focus, memory, anxiety, on and on. And it's very common. And if you get frequent vaginal yeast infections, you almost assuredly have it in the bowel, which is worse. Right. So, because that gets into your bloodstream, literally, candida can cross the blood-brain barrier, and then you got some brain problems. So there's probably something else going on there with her whole microbiome.
Right. Right. Interesting. I appreciate your time so much. I feel like we could keep going on and on.
Almost an endless amount of stuff we can talk about.
I know. So we'll have you back. So I want to have you back to maybe talk about Lyme disease as well. So thyroid and Lyme disease would be two topics that I know that my audience suffers from a lot. Because there aren't a lot of places they can go to get that kind of information. Right. And so if you'd be willing to come back, we would love it.
Absolutely. Love it. Love doing it, spreading the word and letting people know.
Awesome. And for anybody who is listening or watching right now, if you would please send us your questions, your comments. This is how I have people come on and answer them for us. And this is how we get our experts like Dr. Filidei. If you do have a problem, you want to see an expert like Dr. Filidei, he's at our Amen clinics in Costa Mesa. And all of our doctors right now are taking telehealth like everyone else. They're seeing patients by telemedicine. And by Zoom and things like that. So if you're having problems, there's not a reason to suffer. Reach out for someone, and we would just, we hope you guys are surviving well through all of this craziness, and we are doing our best to bring you some great information with some great experts. Thanks, Doctor.
You're very welcome.
Take care.
Next time.
Have a great day.